So first off, thank you for joining us today, Rob.
Oh, my
Uh,
great pleasure.
So let's start off with a little bit about your journey. What was it like hearing that you had throat cancer when you've been making your living with your voice for nearly 3 decades?
Yeah. Well, what's the axiom that we've heard a zillion times, that we make plans and God laughs? A good friend of mine, Julia Sweeney, a former Grounding and Saturday Night Live cast member, wrote a play about her experience with breast cancer called God Said, Ha! And I get that. Um, You know, in my case, it was not, and in my wife's case and son, actually, the three of us, when I was diagnosed, it was 4 years ago, pretty much at this time. Uh, and I was already a guy who'd had a hell of a career. I had pretty much the sort of career that someone in my profession would have said, okay, if I'm done, I'm done. I mean, I'm professionally. But of course, that's very selfish, in that there are people who care about me, want me to stick around most of the time. And I uh, I remember getting the phone call from my oncologist, or rather my ear, nose, and throat doc, and he said, "How you doing?" This was after all the biopsies. I said, "I'm not sure. How am I doing?" He said, "Well, it's cancer, like we thought." And I said, "Wow, okay." Um, and I have to say, neither my wife nor I nor my son or people who care about me ever flipped out. I certainly did not. I think because I was 59 when I was diagnosed, and even if the doctors had told me, "Look, you better go home and get your things in order. We're going to keep you comfortable, but you're on your way out." I had, as I said earlier, nothing about which to complain. I had a hell of a run. But that's not what they said. They said this is sadly a ubiquitous type of cancer, HPV-related cancer, more and more um, um, findable, but it's really treatable. Now, I said, be straight with me. I said, okay, before we cure you, we almost have to kill you. And that is the kind of way I like to be dealt with. Not everybody does. I do. I've got that sort of sense of humor where I laugh and I said, okay, I can do this, because I'm all about humor, even gallows humor. So with an 80% cure rate going in to the fight, I and my wife had nothing but optimism, albeit the usual, well, wow, this is going to be tough. How tough what is tough? I don't know. I've had a broken nose and a couple of things, but what is tough? And it is tough, but there is never a moment in which the treatment superseded my feeling that I was going to get through it. I think my wife probably had moments where she thought that I wasn't going to make it, because she had to see me really struggle. Uh, and so it was really more about, okay, well, they gave me an 85% not remission, cure. And that's important to remember about these types of head and neck cancers, that the cure rate, if detected early, is very high. The treatment's pretty onerous. But the other really important part of my particular story is that as a result of this wonderful career that I still continue to do at this level with Yakko and Pinky and the rest of them, I had innumerable opportunities to speak with children and their families, because the kids wanted to talk to Raphael or Donatello or Yakko or Pinky or Carol Weezer from Jimmy Neutron, and then look what happens to your face. It's so great. And so I got to see what real courage is like, what real tragedy is like. Often these children didn't make it, and their parents would keep in touch with me after the fact. And so when I got diagnosed and folks started to know, or even after I was cured, I don't even know how many parents of children who passed getting in touch with me, say, "Man, fight the good fight. You will never know what Raphael meant to Jordy, or what Pinky meant to Cynthia, or what Donatello meant to Billy. And here's a picture when you came in to meet so-and-so years ago, and he's gone now," all that. So I was never told that I wasn't going to make it. I was never told that your 4-year-old has a glioblastoma. That wasn't what we were dealing with. We were dealing with an old guy who'd had a hell of a run and was fixing to take a punch, like we all do. Everybody takes a punch. No one gets out of here without a couple of dings. And so it was my turn. But the glorious platinum lining of it is what we're doing right now. You guys at Cure are giving me the opportunity to speak from a bully-ish pulpit, because if I can do this after my treatment and go back to work, that's an important message for people to say, what will I be able to do after my throat cancer treatment? Well, hey, this guy does it for money and he's back doing it. So it's a long-winded explanation, but it's important in the context of what we're talking about to let folks know that while the treatment can really get your attention, it is a cure in most cases, not a palliative, remission thing.
That's great. So kind of touching on that whole, you know, visiting children in the hospital, you've talked about that in the past. You've said that the time that you spent visiting children's hospitals, bringing those characters like Yakko, like Pinky to them, it helped you through your own journey. So can you talk a little bit more about that?
I can. In fact, try and stop me. It's it is a privilege, and I think many of you in who do this kind of work with people who are dealing with all different types of cancers, and often, sadly, with their children. It's a real privilege for any of us to be let in to a family's circumstance when they're dealing with a child who is often, hope though they might, told, look, little Rob here, he's a really tough little kid, but I don't, we've got everything we can do. So we're going to try to keep him comfortable. That's happening right now. As you and I are having this lovely chat, someone somewhere is getting a phone call about their 7-year-old. And how on earth do the parents of that sweet little boy or girl deal with it? How do they do it? How do the siblings deal with it? How do the grandparents deal with it? What I love about what you guys do is you talk about how this disease affects everybody, how this is it's a metaphor for what we're experiencing now. It's a mini pandemic when one of your babies has a life-threatening disease or a cancer that's going to take their lives. It affects everybody in their circle. So to be led into that through these silly cartoon characters was a privilege. And it continues to happen to this day. And not just me, we all do it, whether it's Make-A-Wish, whatever. But something as simple as a phone call from, hey, Jimmy, it's Yakko, calling from the water tower. How you feeling, buddy? And mom and dad will be videoing it. And they don't know it's me. It's not about Rob Paulsen. It's about Yakko. I don't draw him and I don't write him, man. I'm just a goofy voice guy. But that connection is pretty amazing. And that is something that actually, after I got done with this whole cancer process personally, gave me an incredibly new, important insight into what I do for a living. That it turns out that joy, empathy, courage, like love, come from the most unexpected places. We've all had that experience of meeting the Bell One and go, where did she come from? How did that guy show up in my life? And this is not dissimilar. And so I can't even tell you how important those experiences were for me, because they really contextualized what is a struggle and what is difficult. And moreover, the fact that all these characters that brought so much joy to these children, and there were maybe 60 or 70 over the years, but billions around the world who love these characters that I and my friends all get to perform. These characters are living right in my head, man. If I can't derive joy out of them, then nobody can. And when I remembered, and as I said, the parents would let me know what these characters meant to them, it fired me up for my own opportunities to find a joke where there wasn't one. And in my case, it was, I submit, integral to my treatment. The doctor said to me more than once, that joke you're making right now, hold on to that. Keep that up. Don't stop that. And if you could maybe go talk to that guy over here, go talk to him. In fact, perfect example, while I was going through my chemo, my buddy Maurice Lamarche, who's the brain, came up to visit me several times. And you know, when people find out, and I mean everybody, the docs, the nurses, everybody, when the patients, when they found out that Pinky and the Brain were sitting at booth 5, where some skinny old guy's getting his chemo treatment, they said, "Wait a minute, that's Pinky, and the other guy, that's the Brain. Are you kidding me? Oh my God!" And it was glorious. We even had a woman, probably 50, who came by. I will never forget this. With her chemo thing on the rolling thing. Love Pinky and the Brain. And after she left, the nurse came over, and it couldn't have been written any better. She was a little tearful, and she said, "That's Mrs. So and so," and she's she's just comfortable, but she's almost done. I mean, with her life. And the joy that that woman got from the fact that these two knuckleheads were doing Pinky and the Brain, it wasn't about us. It wasn't about merchandising. It wasn't about money. It wasn't about ratings. It was a pure expression of joy that happens every time these characters do their thing. And so knowing that they were in here really helped me a lot to get through it. But it was only at the prompting of all these wonderful children who have left a legacy of love and joy, and their parents reminded me of that. It's incalculable. You're looking at a lottery winner, and I know it.
That's great. So you touched a little bit on the idea of a pandemic, obviously.
Mhm.
We can't escape it now. With it affecting people everywhere, what kind of impact is it having on you as a person, but also mainly as a cancer survivor?
None. That's really. I mean, my life is pretty good. Well, the my wife and I are very fortunate for many reasons, not the least of which we have a vacation place here on the Central California coast. And so, if you got to ride the storm out, it's pretty difficult to complain when you get to be at the beach. Um, the usual things that I shouldn't say none, things that are inconvenient. I miss my son. I miss my daughter-in-law. My wife and I would like to be able to see them. But as my wife said, I don't know, a couple of weeks ago, we were just beginning this, and we both have parents who are gone now, but we're parents during the Second World War, and of course we heard a story after story about how the country really did pull together, and as did the Allies, and everybody really did have to ration. They had to ration food, they had to ration nylons, they had to ration metal, everything, and it was all about, we're in this together, folks. We're going to defeat evil. Evil is evil, whether it's the Nazis or something that kills your uncle. It's bad. And I have to say that typically, I like to believe it because I'm just cut from that cloth, that we are seeing how incredibly tied together we are as a world. Anyway, not to get too existential, but it's when we say we're all in this together, we really are. And this is such a great example of the air that we breathe, the interactions we all have, and the opportunity to do something that helps everyone. So I'm trying to be a bit of a student of it. And I think, as you and I discussed at the beginning of earlier this morning, is that we're living in a really miraculous time, both in terms of the fact that we think we're a bunch of badasses, and some tiny little thing that we've never seen before has brought the world to its knees. What does that tell you about how tough we are? On the other hand, immediately there are people doing things as simple as Ninja Turtle masks, or finding ways for the vaccine to be effective, or in your case, finding ramping up the speed with which you do these video casts, and because you have to, necessity is the mother of invention. So I'm kind of understanding that I got to stay where I am, and I've got nothing to complain about. And so we're very fortunate to watch this unfolding, both the good and the bad. But I have to believe that the good's going to win, because that's what happens in cartoons.
It's true. So
Yeah.
how are you handling social distancing? Obviously, being by the beach, that must be are you taking advantage of any like digital meetups or things like that to kind of stay connected to everybody?
Yeah, I've done a couple of Zoom things. I have read a couple of children's books. I am recording from home. We're doing work still. Nickelodeon, Warner Brothers, Disney. We're still in the phases where a guy like me who doesn't have a home studio, I purposely shied away from that because I love being with the other actors. I would much rather be in the studio with all these talented folks who make me way better. Um, and so I have a little rudimentary setup, and we're trying to work out whether or not that is good enough to be broadcast quality. But it's really more about not being able to go do the normal stuff. But that's another. This is why I love conversations like this, because in the context of what we're talking about, cancer is a great contextualizer. You know what I mean? What's a problem? Well, what's a problem pre-cancer and what's a problem post-cancer?
Yeah.
You know what I mean? This is a problem. I get to now I realize I'm unique from most people because we have this place here. However, even if you're at home in Racine, Wisconsin, or where I'm from in Flint, Michigan, if you're home with the people you love with a big screen TV and you can watch every movie that's ever been made in the world ever, or read every book in the Library of Congress ever, it's, unless you get COVID, and of course there's the personal side of it with respect to finances, which we're all dealing with. Who knows if I'll be able to keep this place? I don't know, but I'm here right now. That's what I mean about cancer. It really forces you to live in the moment. And it really has forced my hand to say, right now, today, everything's all right. Everybody's okay. Tomorrow, if I don't make enough money, I lose the place. Well, maybe that's tomorrow. Who knows? But in my case, I've already won, and the rest of it is just gravy. So I am lucky enough to take the opportunities to see the fact that I'm here. And if I hadn't had my treatment, I probably wouldn't be here. Or if I were, I'd be a mess. So I'm taking advantage of my life lesson to learn how to live in the moment.
That's good. So then how are you enjoying being the spokesperson for the Head and Neck Cancer Alliance? I mean, that's a huge part of what we're, talking about right now, with this being Head and Neck Cancer Awareness Week.
Right.
Is the virus having an impact on your role in being able to fulfill those things? What's that like?
Right. Well, firstly, the opportunity is nothing. I've worked really hard for this privilege, and I realize that my privilege to be the spokestune for the Head and Neck Cancer Alliance is a gift from them. But I'm very fortunate to be in this position, and I really crave it. And I'm mainly because of people like you who give me the opportunity to talk about it. It hasn't really affected anything with respect to my work, except been an adjunct, because now when people want to talk to me about Animaniacs coming back on Hulu, or a Pinky and the Brain reboot, or whatever, I say, yeah. And then they say, and I read your book, and how did you throw it? And I said, funny you should ask, because Head and Neck Cancer Alliance, and I get to go into the numbers, and you guys in the profession of helping people deal with cancer understand and allow me to explain that my type of cancer was metastatic stage 3 metastatic squamous cell carcinoma with primary occult, which means that in my case, I had a lump in a lymph gland on the left side of my lymph node, the left side of my neck. And a typical guy, former hockey player, unless I'm bleeding precipitously or I have an appendage that is hanging off, I only go to the doctor once a year for my physical. So I did. And within about literally 5 seconds, he put his hand on, he said, oh, no, that's not good. And I thought he was messing with me. He said, no, you need to go see an ENT tomorrow. And what they know now, they being healthcare professionals, understand that this type of cancer is sadly becoming more and more ubiquitous. People about my age, 40 to 60-ish, it's very prevalent. It is a human papilloma virus related cancer. It often presents itself at the base of the tongue. It often oftener presents itself where the initial tumor is occult, that is to say, unseeable. And so the only way that a person like me would know that you got a problem is by, fortunately, a little lump that shows up, not dissimilar to breast cancer. Sadly, it's, like pancreatic cancer or ovarian cancers, they don't present often with obvious symptoms until it's really a problem. And the first thing I was told, as I said, was, we got this, no surgery in my case, because we got it at stage 3, but significant chemo and radiation. And so now knowing that there are going to be, I think, 600,000 cases of this type of head and neck. And by the way, when we say head and neck, we're talking about tongue, mouth, throat, tonsils, adenoids, sinuses, nasal cavities, not brain cancer. But in those areas, we're going to have 600,000 cases worldwide of HPV-related head and neck cancers this year. But again, the good news is that not only is it treatable with a very aggressive regimen, as is in my case, often it does require surgery, but not in mine. But there is also a vaccine that has been quite effective with cervical cancer prevention in young ladies. That is now the head and neck cancers in men have surpassed cervical cancers in women. So the Head and Neck Cancer Alliance and the rest of the folks in this business are trying to spread the word that the vaccine is available. It is a sexually transmitted virus, which is just part of the deal when you're growing up. And to the extent that the vaccine is available, if I can get somebody say, hey, take a little shot, because then you don't have to go through this, I do it in a heartbeat. However, the good news, there's really good news on both sides. And I think that's what's really important to know. The good news is there's a vaccine. The other good news is that if you are diagnosed with it, it's quite treatable. So get on it. And folks can go to headandneck.org and see yours truly's ugly mug there. But more important, there's great information about self-examination. This is Head and Neck Cancer Awareness Week, and there were going to be a number of places around the country for diagnostic visits. Obviously, they're put on hold now, but there's so much to learn at home. And if you have a lump, trouble swallowing, swollen tonsil, whatever it is, pain, there are so many different things, and it may be nothing, but it may be something, and it's treatable. So go have a look at headandneck.org, and there's a lot of great info there.
Right. We'll get that into the story. So
okay.
Basically, to kind of wrap up, what advice would you give somebody, a patient or a survivor, on kind of navigating life right now? Obviously, this pandemic is throwing everything into disarray. For somebody in those shoes that you've been in, what would you tell them?
It sounds so simple, but at the end of every podcast, I've been doing a podcast for years, and at the end of every podcast, I've appropriated the Reader's Digest blurb that laughter is the best medicine, and I've turned it into my own little version. And I say laughter, pardon me, laughter is the best medicine. The cool thing is you can't OD and the refills are free. And man, I so believe that. I'm not stupid enough to think you can laugh your way out of brain cancer or throat cancer or breast cancer. I get that. But you'll meet, and I have met, many folks who have gone through far worse than I and come out the other end with not only a renewed sense of priorities, but a real keen sense of humor. And when again, I have had the gift of cancer. And when I've gotten to be able to see how people behave, even when they know they're on their way out sometimes, it's just nothing short of astonishing about the power of the human spirit. And it's always, always unfailingly attached with humor or joy in some way. And I would encourage people to find any joy they can. It might even be watching Animaniacs, or Pinky and the Brain, or Ninja Turtles, or or Jimmy Neutron, they're all out there. I'm streaming like crazy, and then you can smile too, just like this pretty lady. And it's that's really important. We already know the physical ramifications and the extent to which humor raises your endorphins and does chemical things to make you feel better. That's all true. Um, but it's pretty easy to start to go down the depression road when you're locked in your home and your kids are around, or you're a single mom and you got 4 kids and you got $8 left. I mean, I can't help with that. I don't know how to get everybody their checks faster. I don't know how to say, yeah, your kids are, it's going to be fine. I don't know that. I would never presume to patronize people that way. We are going to get through this. Some people better than others. It's the truth. But everybody can find a way to laugh. Everybody can find something about someone whom they love or missed or made them laugh like crazy. Pull out your old videotapes, whatever it takes. And and I think that we all have that ability to laugh, and we all need to, in my view, cultivate it. And if there's ever a time when you need to find reasons to be joyful, it's in a circumstance like this. And to the extent that I and my cartoon buddies can help, then tune in. We'll see you at the water tower.
That's great. Awesome. Thank you so much for joining us today.
My pleasure. Thank you very much for having me. It's a pleasure.